Below the skin, we have subcutaneous connective tissue, which may be infiltrated by fat, especially among females, because the fatty component or the fatty tissue of the breast is actually part of the subcutaneous fat. Before we identify the muscles and other structures here, let us first discuss a few important landmarks. One landmark was already mentioned in a previous video clip, and that's the jugular notch. So if you run your finger, starting from the jugular notch, then you run it down along the sternum, you will feel a bump. You will feel a prominent bump, which is actually the sternal angle or the angle of Louis. That is the joint formed between the manubrium of the sternum and the body of the sternum. So the sternal angle is actually a very important landmark because it allows us to count the rib levels and the intercostal space levels. What is the importance of knowing or counting rib levels and intercostal space levels? It's important for a lot of reasons. When we are trying to perform procedures, invasive procedures like thoracentesis or thoracostomy tube insertion, we have to make incisions and insert our needles or tubes at the proper intercostal space levels. So the sternal angle is actually at the same level with the second costal cartilage and the second rib. So we count the rib levels and intercostal spaces using the sternal angle, second costal cartilages, and second rib as our landmarks. Counting rib levels and intercostal space levels are not it's not only important for performing invasive procedures. When we auscultate for heart sounds, when we listen for heart sounds, there are areas in the chest where we can hear heart sounds coming from the four main valves of the heart. We can hear these sounds coming from the valves at specific intercostal levels or intercostal spaces. The sounds coming from the aortic valve, for example, it is best heard at the level of the second intercostal space, right parasternal. Exactly on the opposite side, second intercostal space, left parasternal. That is the auscultation area for the pulmonic valve. So going back on the right side, level of the fifth intercostal space, parasternal, that is our auscultation area for the mitral, the tricuspid valve, the valve in between the right atrium and the right ventricle. Then the last main heart valve, that will be the mitral valve. The auscultation area for the mitral valve is the fifth intercostal space, left mid-clavicular plane, mid-clavicular line, and that is right here. So the mitral valve produces the loudest heart sound, and If we are examining, no, a skinny male patient or a skinny female patient, no, usually the nipple can be used as a landmark also for counting rib and intercostal space levels. However, using the nipple is not that accurate. So in males, no, and in women with small or not women with medium-sized breasts, no, the nipple will usually fall at the level of the fourth intercostal space. So I can palpate here, right here. This is fourth intercostal space. I can palpate here the fifth rib, no? And the interspace below the nipple, no, is the fifth intercostal space, no? So again, for females, no, voluptuous females with big breasts, the nipple cannot be, it's not that accurate, no, to use the nipple as landmark for counting rib and intercostal levels.